Hey everybody. Welcome to our little session on exploring opportunities in public health. I see that Dr. Washira just logged on, so we're just kind of waiting for other people to continue joining us. For your information, my name's Dr. Steve Pruitt. I'm the Assistant Department Chair for Health and Human Performance, but Dr. Washira is the actual main program coordinator, and she will be kind of leading our discussion and our talk today. So just wanted to keep you up to date on what's going on. And again, thank you for joining us. And it should be very interesting and hopefully very informative. So there she is, Dr. E. How are you doing?
I'm good. I'm good. Sorry, guys. I am in Decatur, Texas, and the satellite, everybody and the cows are tuned in today. So apologies for that, but I'm so glad to be here. Dr. Pruitt, do I just jump in?
I guess so.
Do I get started?
Yeah.
Okay.
Yeah, go ahead. And I think people will be joining in, but it looks like the university is recording this. So if people miss out on
it, perfect.
They can they should be posted somewhere. So
okay. All right, then let me share my screen. Let me work to share my screen. I created a PowerPoint presentation that I am hoping y'all can see. Let me get this started here. We're learning. I've never done a presentation via Zoom. I'm hoping everybody can see that okay? All right. So my name is Dr. Elizabeth, or Dr. Elizabeth Washira, as Dr. Pruitt has said. My students and everybody call me Dr. E. So that is myself. As we talk, let's say hello via the chat box. Let me know where you are tuning in from, because we will be working together for the next 4 years, so we can definitely get started connecting. So welcome to the Public Health Case. I see all of you are on mute, so that is good. If you have any questions during my presentation, you can just do a chat box and I'll make sure to keep attention with that. But I will also frequently do some question and answer checkpoints if you have anything. And if you would like to connect after this, you can follow us on our social media sites, which I will show on the next slide. We are on Facebook, Twitter, and Instagram, but we also are on the website at TAMUC, and I have my profile link right there, just so that you can know a little bit more about me and what I do in regards to public health here at A&M Commerce. And you can always shoot me an email at elizabeth.washira@tamuc.edu. I love talking public health. I love talking to people about public health. So any emails you may have, please feel free to reach out. And here are those social media sites that you can definitely connect us with. We are on the website, we are on Facebook, and again on Twitter and Instagram. And these particular social media sites are where we use to share resources and information, because the Health and Human Performance is a wellness program in and of itself. So we have great things that we do on campus, from exercise, nutrition, to health fairs. So we definitely share all that information. So you can go ahead and plug in, get connected, and we'll go from there. And that is myself. This is the first day of class this spring. It feels like forever ago. And this is my Intro to Public Health course. This is a course that you will take very early in your degree. But that is myself. That is one of the classes I teach along with other ones. A little about me: my background is in nursing, have a nursing degree, that's my first degree, and then my master's and PhD are in public health. So if any of you want to go into other fields after this, definitely we can get your questions answered. So this is a long quote, don't read it. It's on my faculty profile. But the reason I do public health, which I think is why you are all here, is because you want to make a difference. You love people. You enjoy being with people. You enjoy helping people. And this is why I got into public health. This is the picture on the right, my right, shows our group, our classroom last semester. We did a mental health program on campus for our students. The students did all that. And so I get to do public health every single day. And when you come into the public health program, you will get to do public health. Not only will we learn it, we will also do it, right? Because why not start making a difference on our campus right now? And when you graduate, you will know how to plan programs. You will know how to interview people, how to look at data, to make good decisions. So this is why I do public health, and everybody that I meet, the students, and I cannot wait to meet you all at some point. One thing that ties us all together is we want to make a difference. We want to help our community. We want to help our church. We want to help our school. We want to help our family. And public health gives you a way to do that. So we are part of the Health and Human Performance, and I want to plug this in really well because our department is very diverse. Dr. Pruitt is in physical education, teacher education. You have kinesiology, you have sports recreation and management, you have hardcore kines, right? Body mechanics, sports studies, and then public health is right there in the middle. And I connect everybody together because public health is all about people. So the department you're coming into is very diverse. And even if you are doing a public health degree, you can do a minor in one of the AHP majors. So you can kind of get an idea of what everything looks like. So maybe you don't want to necessarily go into coaching full time, but you want some of that experience. You want some kines experience. You can tag team those two. So it's a great department. You made the best choice ever. The first one to come to A&M Commerce, the second one to be in this Health and Human Performance. And I brag about that all the time. So this is us. Let me get right down to public health. This is another visual of my class in last spring. We did our very first student health fair on campus, and you can see they're happy. They're really happy. And so the students do it all. I am just there to help them. They plan it. They learn how to plan. They learn how to find vendors, and they put together a health fair that the campus benefits from. Your classmates, your peers, your faculty and staff will attend something that you have created that helps us work towards a healthy lifestyle. So I want to do a real quick Q&A with all of you. Let me know, what does health mean to you? Okay, what does health mean to you, or what affects your health? Please give me a chat box here so I can see you. Okay, let me see what you think. Dr. Pruitt, you can moderate the chat box because for some reason I'm not able to see it very well. But what does health mean to you? Somebody tell me something. Okay, let's see here. The well-being of your environment, absolutely. Okay, anybody else? Give me 3 answers and we'll move on. We can do this. Yes, we can. What does health mean to you? There is no wrong or right, okay? Well-being of your environment, your own body. Somebody else? Dr. Pruitt, what does health mean to you?
Let's see. Health to me actually is the all-encompassing well-being. It's physical, mental, social, environmental, all of these working together to just kind of work on improving overall quality of life.
Yes, That's a very good. So tag teaming with what Ari, I don't want to mispronounce your name, but Ariana said, environmental health as well, your own body. So health is anything that affects you, whether that is physical, emotional, social, financial, right? Think about when you don't have money and you want to eat or want to go to the doctor and you need that money, you cannot either get food to eat or you cannot get that healthcare service you need. So your finances are very much tied to your well-being, right? Think about going through a very traumatic event and how that affects your emotional well-being, right? You may not be able to sleep well. You may not be able to relate with other people well. You may start coping in some ways that are negative, start drinking a little bit more, start going into recreational drug use, and that in turn impacts your physical health. So your emotional well-being, and then the habits and the behaviors you put on in turn impact your physical health. So health is all encompassing, and I like that word, right? So let me see my clicker here. Oh, okay. So when we think about it that way, health is basically affected by everything, right? Money, education. Do you live in a community where you can go to a ER center real quick, or do you have to drive 2 hours away to get health care? If maybe your grandparent has a heart attack, when you call 911, does it take 5 minutes or does it take 60 minutes for that, for that ambulance to get there? Access. Laws, right? Think about the click it or ticket laws. Think about drunk driving, policies against drunk driving, right? You want to feel safe when you're driving on these roads at night. So you want to know that the law enforcement is catching people that are drinking while intoxicated, because that puts them not only at risk, but puts you at risk. Think about community, the community you live in, right? In public health, we tackle things like segregation. We talk about discrimination. Do you live in a community where you feel oppressed or discriminated because of the color of your skin, your accent, where you were born, what you believe, the lifestyle you live? Those things ultimately affect your mental well-being as well. Safe roads, man. If you drive on the road at night and you hit a pothole that could fit a coffin, literally, that's going to mess up your car, right? That's going to put you in some serious financial distress. So who's upkeeping your roads? Not only the maintenance, but the safety of them, right? When we all go get a driver's license, they check one thing for all of us, a vision test. And that vision test is to make sure that if I'm on the road driving, I need to make sure I have my glasses, because if I cannot see past my hand, I will definitely not see that pedestrian. I will definitely not see you or another car. So all these things affect health, right? All these things affect health. Dr. E, why are you talking about this? Well, the degree you will get is public health, right? 2 words, public health. So health is a huge component of what we'll be learning about, but then the other part of that is public health. So let me apply this to something all of us. You do not have to have gone to school, but let's talk about COVID-19. The fact that we are doing this orientation virtually means that something has happened to completely change how we are living, how we are doing things. So think about how COVID-19 has affected you, right? You may not be diagnosed with COVID-19. You're not sick with this virus. Health is not just the absence of disease. Health is not saying, oh, I don't have the flu, I don't have HIV, I don't have diabetes. It's a lot of other things. How do other people that live with certain health issues, how are you impacted? So think about COVID-19. On your chat box, let me know, how has this affected you and your immediate family, right? For example, going to the grocery store. I mean, when we go to the grocery store, we are all just masked out now. If you'd have thought about that 2 months ago, you'd have been like, get out of here, never, we will never, no, 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 no. But here we are working from home, staying at home, limiting transactions between people, right? So COVID-19 has affected all of us tremendously, right? A lot of negative impact on our mental health. Absolutely. I mean, I don't have COVID-19 and I'm thankful for that, but it has affected my mental well-being, right? My sleep cycle is all over the place. How I'm able to interact socially, right? I can't just go and hang out with my friends anymore. That social support, we're starting to realize there's so many things we really need that affect us that we never realized till now, right? So think about the challenges we are seeing. Challenges related to people losing their job, employment. Is employment impacting the health and well-being of that person? Absolutely, because they're worrying about how are they going to pay their bills? How are they going to take care of this? Schools now being at home, is that affecting families? Absolutely. If you are a parent or you know somebody that is a parent to K through 12, you tell them how they're sleeping at night. Ask them if they're happy right this moment, if it's all ha 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 24/7. No, it's not. They don't have COVID-19, but it has affected them. So health is everything around us, the people around us, the things we do, how we do them, okay? So use COVID-19 as a perfect example. And this has really shown us the importance of public health. Before this time, maybe many people did not know what public health did, okay? Public health, we've always been on the background, tackling pandemics, tackling things that are happening, whether it's HIV/AIDS, domestic violence, alcohol abuse, gun violence, mass shootings, all those things are public health issues, okay? This one just so happens to be in the limelight. And one of the courses you will take as part of the public health degree is epidemiology, which is the study of the distribution of diseases. Where is COVID-19 right now? Is it in Africa? Is it in North America? How many people are affected? How many people have died? What do those people look like? Are they Black, African, Hispanic? Are they low income? Do they have insurance? Where do they live? Because all those things matter to in terms of what the knowledge they have, the access they have. Are they covered with insurance? That's a big issue, right? Do you have a job that gives you sick leave? Okay, all those things impact public health. So now I can go to now public health. All of you are public health majors, okay? What does public health mean to you, okay? Shoot me a text on the chat box. What does public health mean to you? No right or wrong answer, right? Because my definition is a little different based on what I know, based on my preferences. So what does public health mean to you? Okay, shoot me a chat box on there and let me know. I'm not gonna ask Dr. Prude because he's a colleague, so he knows what public health is. So he has answers to the final exam, so he doesn't count. So somebody else. Anybody, somebody, talk to me. Let me see what you said. Okay, all right, Ariane Osborne, shoot me an email after this. We gotta connect because we're connecting here. The interactions between members of a community as well as the economy and the environment. Absolutely, you get an A+++. Public health to me means the well-being of everyone as a whole. Absolutely. Protecting and improving the health of people and the communities. Yes. One more. Somebody give me one more. Give me something, okay? But these ensuring the safety of those around you. Thank you. Yes. All those are right. And the one thing that ties all of those definitions you just gave me, it's not my health alone. It is my health in relationship to somebody else's health. Because when Dr. Pruitt is not healthy and his circumstances are not healthy, when I come to work with him, we share a space. And what he may be feeling, he may put those emotions out on me. He may treat me differently, right? And then that experience in that space also affects me. So the health of the public is my health in relation to everybody's health. The all-around health status of the publics on the local and global level, absolutely. Public health can be as local as you want it or as global as you want it. Think about COVID-19. Started in Wuhan, China, right? I took a class during my PhD, and the professor said, viruses do not need visas to travel. You may need a visa to go to Australia today, but a virus, it needs no permission. It does not need any authority. It can cross any borders wherever. And diseases travel. Think about somebody that took a plane from Wuhan, China to JFK Airport in New York. That disease travels, that virus travels from there to that place and to other places. So you may say, man, that's happening in China. That has nothing to do with me. But public health is local and global, and the people that are impacted and affected by that. Thank you very much for that. I love that. So public health, what we do, what you and I will do, is we work to promote and protect the health of all those people. We work to create spaces where you live, work, and play supports good health. For example, housing. People that live homelessness, their quality of life is very poor. They die quicker, okay? Life expectancy for somebody that is homeless is between 48 to 52 years. So think about your parents right now. They're probably somewhere there. For somebody that is living homeless, that is their life expectancy. Housing impacts. Think about when you have the flu. You want to go to your bed, get away from everybody, just put on your Netflix, get your chicken noodle soup or whatever you want to get, whether you cook it or you get it from Chick-fil-A or your mom brings it to you. All you want to do is be in a hot room with a fan, watch your Netflix, and just sleep. People that are living under a bridge don't have that, right? So housing impacts health. Education, the quality of education. Think about a school in a poor neighborhood versus a school in a very rich neighborhood, okay? The bougie folk, okay? That go on a study abroad program to Europe for a month, while us, we're celebrating going to Walmart to learn nutrition for a whole hour, okay? We get Walmart, they get Europe, okay? Education, taxes, social support. When you're dealing with a mental health crisis, do you have people that you can go to, okay? Your family members, or do you live in a community that stigmatizes mental health, or the LGBTQ community, okay? Do you live in somewhere that embraces who you are, sexual identity, sexual orientation, religious identity, religious orientation, or do you feel discriminated against? Social support. So everything impacts health. And for us in public health, we care about all of those things, right? We care about, exactly, my mom is very against it. So social norms, our family thoughts, right? So whether it's religion, whether it's a decision on a lifestyle, whether it's a disease, HIV/AIDS, if you get diagnosed with HIV/AIDS and you know your family man does not talk very nice about people that have HIV/AIDS, are you going to tell them, hey guys, I have HIV/AIDS? No. You may have access to medication, you may have access to care, but your social support may be lacking, and that impacts your health. So us in public health, we focus on all these things. We put the people in the middle, and we find out what is affecting their health and what can we do about it by creating interventions. The medicine that we give the public to heal public health is not a pill, it's a program. It's an intervention. It's policy, writing good policies that don't discriminate against people by their skin color, their immigration status, their LGBTQ status, policies that protect everybody, that bring access to everybody, okay? So our pill is an intervention. So think about COVID-19. COVID-19, we can't just fix it with medication. Think about people that have lost their jobs. They need support. Think about people that are going to school online. They need internet. They need support. So it's not just one thing that we do. We do a lot of things. And that brings me to my next point, which is our focus is broad. But if you're like me, I love different things. I get tired of eating the same food. I get tired of wearing the same color. I get tired of wearing the same shoe. I probably have 100 plus shoes. Don't say I said that. Okay, that's for you. But I'm diverse. I'm very eclectic. I like HIV/AIDS. I like diabetes. Oh, I like domestic violence, learning about it. Oh, I like working with people living in Australia. Oh my goodness, yes. I like working with refugees. Oh, wow, yes. I like working with students. Public health allows you to do all of that in terms of you either say, you know what, I want to work with immigrants. I want to work with the Latina community because I'm Latina and I see the challenges they go through. So that's what I want to do. Or you may say, I want to work with at-risk kids because I have grown up in a very poor neighborhood that crime was this, and if there was not this after-school program, I would have gone into drugs and other things. So public health allows you to focus on many things, but the way we focus on those, the pill, is programs, research, policy, understanding, putting people in the middle and asking ourselves what impacts the health of those people and what can we do about it, okay? So public health is fun. It's the best thing you can do. So doing public health, we prevent diseases, we protect people that get diseases, and we promote health, okay? Nursing falls into this. Medical doctors fall into this. Law enforcement falls into this. Because remember, health is not just, I don't have COVID-19. Health is, I don't have insurance. I don't have somewhere safe to live. I don't feel loved in my community. I feel discriminated against. I don't have a car to get me to my doctor's appointment. My doctor and I don't see eye to eye, okay? So doing public health, you find your place in terms of, man, I want to work with people that have been survivors of human trafficking, okay? That's public health. Why? Because human trafficking, people that do you know that college students are one of the at-risk population for human trafficking in this country, right? So it's not just people traveling to Europe. You know, we've all seen Taken. I don't know who you are. I don't know where you are, but I will find you. I have a great set of skills. We all know Taken, okay? But that's not the perfect definition of human trafficking nowadays. Human trafficking is happening in our backyard, okay? So we have to tackle it because victims of human trafficking have PTSD challenges, mental health issues. Maybe they come out of that addicted to drugs. They've been raped, okay? They have been abused in many ways. So you can't just say, okay, we've saved you. No, there has to be a process that you walk those individuals in. So maybe that is your area. Public health is a platform for you, okay? But then think about all the people you would work with: social workers, doctors, psychologists, counselors, teachers, law enforcement. All those people make up the public health circle. We cannot do public health by ourselves. We need everybody, okay? So in this program, skills that, and if you have any questions, definitely let me know. Skills that you will learn in public health is how to do health promotion, how to coordinate programs, okay? I showed you a picture of the health fair. You will learn how to put together programs such as health fairs and other things. You will learn how to interview people and ask them, what is your greatest health need? What are challenges you face in your community? You will learn how to go into the internet and find data. I'm Kenyan, so my accent sometimes kicks in, but you will learn how to find data to be able to show that domestic violence is an issue, and this is why. Domestic violence is very important, and this is why, okay? If you love fitness, learning how to develop fitness and wellness programs. Remember, our pill is programs. It's an intervention that we create, and we bring other people to help us do that intervention. Have you ever tried to tell somebody to do something and you can't pay them? You'll learn how to ask. You will learn how to motivate and empower people to want to make a difference. You'll be like, come on, guys, we can do this. Yes, we can't pay you, but you know you're making a difference in society. So come help us. Give us those funds. Give us those resources. You will learn how to talk with people, talk to people, and talk alongside people so you can work with people. Remember, public health is not just me, it's all of us. So team building skills, oh, you will learn them, right? Administrative duties, writing a budget, figuring out who do we need, marketing. You can create the best program, but if you don't know how to market it on social media, ain't nobody gonna come to that. If nobody is hearing about it, seeing it, and you're not doing it in a way that you want them to come to that event, you're gonna have this event and nobody's gonna show up. You've worked for 6 months and nobody is going to show up to that event. So marketing, we want to market good health, okay? We learn to work with special populations, right? Because in public health, we focus on the most vulnerable because we don't have resources. Unless you got a hookup, okay, to Bill Gates and some other folk that got money, you let us know so we can write a proposal and get funding. But usually, unfortunately, resources are limited. So we get to learn how to make a budget of $0 become a budget of $3,000, right? By asking people, by partnerships, and working with special population, the elderly, children, physically and mentally challenged, immigrants, okay, racial and ethnic minorities, sexual minorities, people that have not grown up in a certain place, but also the general public, okay? So that are the skills that you learn in public health. And then you learn how to network. Your network is your net worth. I mentioned we have a budget of $0. So if you know somebody that can do radio broadcasting and can give you 30 seconds to promote that program that you're doing, you're gonna say, hey, so we have this program for our students, and can you please, make an ad to promote that? And we will also now showcase that you have supported us. Networking, okay, networking, right? So those are some of the skills, some, okay? Remember, this is a 45-minute presentation, so we can be here all day, okay? Some of the skills. So students in class, these are some of the things we have done. Fall 2019, we did a End the Stigma mental health program. The reason we did that was the students that planned that program did a needs assessment. Remember, public health is putting people in the center. So we have to talk to those people. What is the major issue on our campus? What are some of the challenges you face as a student? And so they did interviews, they did focus groups, they did a survey, and they found that one of the biggest challenges on our campus for students is mental health, specifically mental health stigma and lack of resources. So remember, public health pill is an intervention. So we planned a program, okay? And this program was called Break the Cycle because we were focusing on promoting mental health awareness, but also tackling stigma. They designed the flyer, they came up with the hashtags, they decided on the date that we are going to do, the date, the time, and the location. They did it all. They marketed, They went and did a radio interview. They wrote newsletters on the newspaper. They promoted, they did this, they planned the education session. This is all stuff you will do, okay? The next one is exercise is medicine. We partner up with others. Public health, we don't always do the program. Part of that may be supporting the program, helping facilitate the program, okay? Also did a community health fair. This is for the city of Emory. We partnered up with nursing. Again, public health, you do it with other people. We partnered up with the nursing department and we put together this community health fair for the city of Emory. And then this slide right here, this was last spring. This was our very first student health fair. We just did one last week, actually, because we had planned to do our second student health fair on April 7th. But COVID-19 happened, right? COVID-19 has affected everybody. And so we turned that into a virtual health fair. So the students, what they were going to talk, the vendors they were going to work with, we just asked them to create a video and did the virtual health fair last week, Tuesday, and it went very, very well. Again, these are things that you will be doing, okay, as part of class. We conduct a needs assessment for campus. This is actually one we are doing right now, where the question is, how can we improve our campus health? So we're talking to faculty, staff, and students. Public health, we put people in the middle. We don't plan programs for them, we plan programs with them. And the way to do that is to say, what is the challenges you face? What are some things you would like to see? And based on that, we work on it, we look at it, and we create a program, okay? So qualities of public health, okay? What makes you a good fit for public health? One thing is you love people or you want to make a difference. You want to make a difference. Whether it is in the health world, in access, okay, working with people, teaching, talking, doing wellness, developing programs, creative, like to learn how to be creative, likes a flexible schedule, wants to help others quit smoking, begin exercises, control stress, come out about their sexual orientation, tackle HIV/AIDS, tackle COVID-19, work with your church to create a good youth program. Public health. We put people in the middle of everything we do and we want to make a difference, okay? That could be, you want to be a lawyer, okay? All these things that I've listed here they do public health. They just may be called lawyers. How does a lawyer do public health? If it's a lawyer that is supporting a client that has gone through a domestic violence case, and they make sure that that client gets the access that they need to be able to go to resume their normal life, whether it is money for medical bills, whether it is talking about the discrimination that person has faced in their job. Okay, that's public health, because we focus on where we live, work, and play. A social worker. Social work, we tend to know them more with children and hospitals. If you have just had surgery and you need to go home with home health, or you need to start going to dialysis, you have no idea how to even start scheduling those services. But a social worker helps you bridge the gap, helps you connect with your home health nurse. It helps you connect with that dialysis center that you need to go with. They help bring access to something that you need to have good health, right? Does that make sense? So all of us do public health in various ways, and that's the beauty of public health. You can do it at the local, the state, the national, or the global. You can say, I want to work with immigrants in Dallas County, but then you can also work with the immigrant population at the state, at the national, at the global level. You do the same things, you just work on them a little differently, okay? So again, doing public health, there are many, many ways to do that. Because remember, if you are working to promote the health of other people, you're doing public health. And you can do that in very many types of ways, okay? Some careers, okay? Restaurant inspectors, if you're like me and you like Chuy's, you want to know that that chimichanga was cooked in a very safe and clean environment, okay? So the people that go and inspect restaurants, that make sure that they have thermometers, that they clean their spaces, their employees wear hair nets, wash their hands. We like those people because they tell us, yeah, this place, is good to eat. That's public health because I want to make sure that the person making my chimichanga, okay, has washed their hands. But since I can't go back there, I can at least rest assured for the most part that they have an environment where washing their hands, you're able to do that. Where putting on a glove, you're able to do that. And those are the things that restaurant inspectors will make sure, okay? So your employees are washing hands, but there's no sink. What something's missing here, right? So you eat better, knowing that the only thing you're gonna get and take home is calories, but not a virus. All I want to take home is calories, okay? Those I can work out, but a virus, having to go to the doctor because I had food poisoning, we don't want that, okay? So community planners, social workers, public health practitioners, epidemiology. With COVID-19, the people that you're seeing coming to talk about flattening the curve, saying if we don't do this, this will happen, that's epidemiology, the study of the distribution of diseases and the determinants of that disease, okay? So I would say the best way to figure out your niche is to find your place at the table. What are you passionate about? Is it diabetes? Is it policy? Is it research? Is it IT? But you want to do it in public health, you just have to find your place at the table. And this program will get you exposed to the traditional careers in public health. And then you find your fit and you adapt that to your preference, your skill set, and you either find a job or create a job for yourself. Right now, because of COVID-19, organizations have realized the importance of a public health professional in their building, okay? So everybody, whether they are a hospital or whether they sell tools, they are looking for people to come and to show them how can we maintain health for our employees. So I've seen a lot of jobs shoot up because of COVID-19, and a lot of jobs will be created because we finally realize we cannot just tackle diseases when we have them. We have to tackle diseases before we have them because it is cheaper and easier to prevent a disease than to treat a disease. So public health is a place for people that want to prevent diseases, keep people from going to the hospital. So that is public health in a nutshell. That is the whole 4-year degree plan in a nutshell. Good job, Dr. E. Good job, Dr. E. There's so much more to learn. And right now, before you even start, you can connect with some public health platforms. If you're on Facebook or Instagram, Public Health Gladiators, American Public Health Association, Center for Disease Control. Do you notice these are things that these are organizations we've been hearing from, the WHO, World Health Organization. So those, you can follow them. They have social media platforms because they showcase different things about public health. Because you may think public health is just epidemiology, finding out who gets, who has COVID-19. There is so much more to public health. And the best way to know that is to get into that. And one of the ones I really follow is the American Public Health Association and the Public Health Gladiators. So I want to wrap up with COVID-19 and public health, okay? This is a flyer made by one of my students. She doing her internship right now at the Hunt County Health Department. And part of your program, you're required to do an internship, okay? So she created this flyer. I challenged her to do it. because public health is also about giving information in a way that everybody can understand, in a way your grandmother can understand, okay? So giving just very basic tips. And now you notice this was created before masks were now encouraged, okay? So we have to go back and update it. And public health is always changing. Public health is always changing. So COVID-19, what you have seen in the news, the people you have been hearing come and give, you may say bad news, but come and give the reality of the numbers. Our numbers have gotten to this level. We are noticing that now this virus can be transmitted this kind of way. Those are epidemiologists. They're all about studying those diseases and how they're coming up in our community. So that's a class you will take, okay? Health promotion. You're seeing a lot of videos about how to make a mask, how to wash your hands, how to, how to sanitize correctly. That is somebody saying, rather than having people go read from the CDC, let me make a 2-minute video that my community can understand, right? So health communication, promotion, our churches, right? The church I go to, we had to come up with some tip sheets on, hey, working with the elderly, how will pastors now go pray for the sick? They can't do that anymore, right? So I became an expert for my church and other church communities because I'm a public health person. So when you go into public health, you become the public health expert because you're interested in this stuff, but you say, my Spanish-speaking grandmother is not going to understand what the CDC just said. So let me say it in very good Spanish, muy despacio, very slowly, in language that somebody can understand. So you take that content, okay? You make it lay terms for people to understand, and you keep saying it in many, many ways. You tweet about it, you Insta, you put it on your story, you do a video, you do a FaceTime. You're promoting the health of other people, right? So that is public health. So right now, I did a very good job. Dr. Pruitt, I have 10 minutes, right? Okay, so let me get any questions you may have. If there are any questions from anybody, you can either, put them on the chat or ask them, and I will answer. Again, you can connect with us on our TAMU CHHP page. My email is elizabeth.washera@tamuc.edu, and I will type it in the chat box. Any questions? Who's excited about public health? I am. Give me a 1. Give me I think you can do an emoticon, a reaction. Give me a thumbs up, a clap, something. Okay. Yes, Viviana. Yes, I am too. Yes. I stay excited about public health. It's everything. I mean, I live it, I breathe it, I talk it. Yes, Crystal. Yes, yes, yes. And I cannot wait to connect with you all when you finally start the program. And congratulations for your acceptance and for choosing this great institution. I think you'll have fun. And another way I also teach is in the classes. I bring in professionals in public health that do different things. A hospital administrator, a public health nurse, somebody in policy, somebody in research, just so that you can kind of see the different faces of public health, but also see the similarities. The similarities, regardless of whether it's public health law, public health nursing, or policy, they're all about improving the health of the public. So I'm very excited. Again, reach out to me, connect with us on our social media sites. And yes, other than that, I think I am good. Dr. Pruitt, if there is anything else.
No, Dr. E, thank you very much for coming in and sharing your expertise and obviously your passion about public health. And to those of you who are part of this, this this is how she is every day. Just energy, energy, energy. We love having her around, and this concept of everybody working together is something that we all do. Even though my area is in PE and coaching, a lot of the stuff that Dr. E talks about as far as like the physical health, there's a lot of crossover there. And so you'll see that in a lot of the classes that you would be taking. So you have Dr. E's information. I just want to say thank you for taking the time to investigate just different opportunities. And as we learned, there are a lot of opportunities within this realm of public health. So that's all we have for today. And I hope everyone stays safe, stays healthy, and we hope to see you in class real soon. All right. Thank you very much, everyone. See you later.